Hey guys, Dr. Reed here. What I want to show you today with a little whiteboard Wednesday, promise I won't make this an every Wednesday kind of thing, is what I call the awareness pyramid or the conscientiousness or consciousness pyramid. So what this is something that I like to explain to patients, especially those who don't really understand why they're here and what they're feeling, because sometimes that takes place, or it's one of these things where, how did it become this bad? Well, we reached a certain threshold where we raised awareness of an issue. Okay? And this happens with everything. So what this is a pyramid, just like the food pyramid. We want most of our stuff, regardless of what you think of the food pyramid, I disagree as well, on the bottom or the biggest, bulkiest portion or area of that pyramid. So we want most of our movements to be unconsciously functional, right? That seems pretty straightforward. On the opposite end of that, we want as few movements as possible to be unconsciously dysfunctional, right? We don't know that we're moving poorly. Well, what happens is we do have some movements that are unconsciously dysfunctional. That's fine. Usually they don't raise an issue or a complaint until we reach a certain threshold. Typically what happens is pain or your symptoms insert at some point after we reach that threshold, and therefore we raise consciousness of it or awareness of this dysfunction, of this movement pattern, okay? So this is the general progression of things, is to go down this pyramid, right? So once we reach conscious dysfunction, now what? That's where you seek a therapist or a provider like me, or whomever you like to see, a coach or just general training. Maybe it's YouTube, hopefully it's not WebMD. And with that conscientiousness, we try to change this dysfunction to something more functional. So this is, like I said, where somebody like me steps in, and through time and repetition, we raise awareness of this and we continue to be aware of this. We try to change these patterns to be more effective and efficient, therefore more functional compared to unfunctional. Like I just mentioned, time and repetition is what brings us between these 2 points. So time and repetition allow this function to stick subconsciously or unconsciously, okay? We don't want to think about every single step we take. Are my toes pointed straight forward? Am I extending through my femoral acetabular joint like my coach or therapist wanted me to? We should just be out there walking normally, unconsciously, and still be functional, okay? So again, what this is a awareness pyramid that I like explaining to individuals who might not understand where their pain and symptoms lie and what this threshold might mean to their movement patterns. So I hope you enjoy that, and if you have any questions, let me know.